And welcome back to the Wellness Paradox podcast. I'm so grateful that you can join us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena I call the wellness paradox. This paradox, as I view it, is the trust, interaction, and communication gap that exists between fitness professionals and our medical community. This podcast is all about closing off that gap by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that in episode 91, I'm joined by Dr. Joseph Signorile. Dr. Signorile is a researcher at the University of Miami, and he specifically has been studying for the majority of his career the role of power development in the aging adult population. This is going to be a fascinating conversation about the important role in maintaining and, in fact, improving power as an individual ages. And we'll get into this discussion around what power is relative to a concept like strength, which many of us are aware of, and how we can go about encouraging that power development in an aging adult population. Dr. Signorile has a wealth of knowledge in this area. There's going to be a number of great resources to link up to on the show notes page. So please make sure you check that out after the episode. That can be found at wellnessparadoxpod.com/episode 91. I hope you enjoy this conversation with Dr. Joseph Signorile. Today, we're delighted to be joined by Dr. Joe Signorile. Dr. Signorile, thank you so much for joining us.
Thank you for inviting me, Michael.
Very excited to have this conversation. You and I have a mutual friend in David Sandler that we both know, so it's nice to be able to connect with you, to have a conversation that I think is going to be really meaningful for our audience around training the aging adult population, particularly with regard to power development. But before we launch into that discussion in particular, why don't you just give our audience a little bit of an idea of your background to provide some context for the discussion?
All right. I did my master's at University of Florida, my doctorate at Texas A&M, and I've been here at the University of Miami for about 30 years. And this is where I began my work on aging. It actually began with one of my master's students. I had been studying an ergogenic aid prior to that, and my master's student came to me and had seen all of the wonderful work that had been done in Massachusetts, in the universities there, and asked me if we could repeat that work. And I said, yes, I'd be happy to do that, with the aging population, but I'd like to see if we could find something unique. And that led us to find the work of Dr. John Lexell, who was from Sweden, who started to speak about in his papers the decline in faster contracting motor units with older individuals. So we put that together with the concept of sarcopenia. And as you know, if sarcopenia is related to some extent to strength, then the loss in the faster contracting motor units should be related to speed. And we put those two together and we said power training looks like the way to go. And our first presentation of that was, I guess, at ACSM in 1993. So that's where this whole thing got started.
Awesome. Well, one thing's clear. You've stayed in warmer climates for the majority of your career. I'm sitting here in Ann Arbor, Michigan in the early part of March. It's significantly colder than what it is down there in southern Florida. So you've made the wise decision there.
Well, when we first decided where to go, my wife drew a line across the country where it froze and where it didn't. So that's why I'm here.
Fair enough. So I think you've set the groundwork really well for the discussion we're going to have today in general terms. And, certainly I always remind fitness professionals that the aging population is something that is becoming increasingly more important to consider because, we are graying as a country. I think, by 2030 or 2035, there'll be more people over the age of 65 than under the age of 18. So this is a market that needs to be served by fitness professionals, but is underserved or not served at all in some cases. So I think this conversation is really helpful around a training paradigm for that population. Let's start with, I think, the most important distinction in this discussion. You've mentioned the role of, faster contracting muscle fibers and motor units and the decline in power with age. So let's level set by defining power versus strength, how they're different, how they're similar, because I think a lot of people use the terms interchangeably, but from a mechanical perspective, they are very different things.
Yeah, absolutely they are. So strength, we're probably all familiar with. The typical way we'll measure strength is by looking at a 1RM, or what's the maximal load an individual can move. So that's strength in effect. However, when we look at power, we, from a physics point of view, we'd say it's the rate of doing work. Mm-hmm. I think from our point of view, if we're going to relate it to strength, we can say it's the rate at which we can produce strength. So we have a very, very famous curve, which probably most of your listeners are familiar with, called force velocity curve. We like to talk about it more as a load velocity curve. Because we're doing an external load and asking people to move at a certain velocity. And so this is really where power comes in. I can look at maximal strength. If I look at maximal strength, my velocity is going to be down to 0. Mm-hmm. And so if power is the product of strength and velocity, now that load end of the curve where maximal strength takes place is going to give me very, very low power. Mm-hmm. And if I go all the way to the other end and completely unload the individual, now the velocity is going to be all the way up, but again, very low power. So that means there's got to be a sweet spot somewhere in the middle where we can maximize what we call power. And that is the rate of doing work or the rate of producing strength.
Yeah, and that's a great way to frame it up. Now, let's extend that a step further, functionally speaking, because I think in a laboratory sense, that makes a lot of sense. But, in the real world, particularly for the aging adult, why the focus on both, strength and, for this particular discussion, power?
Sure. Well, the first thing, if you look at it from the literature, we know that power is directly related to probability of falls. Mm-hmm. We know that power is directly related to ADL performance, the performance of activities of daily living, and of course, the maintenance of independence. So from a mechanical point of view, power is probably one of the most important variables for maintaining independence. And one of the interesting things is it drops down at a much faster rate than strength does. And so everything points to us targeting this in order to maintain independence. We've also used it now as we know that it's directly related to cognitive performance. There's been some papers showing that. So we also use power training in our laboratory to work on cognition. So now, obviously, this means there's a bunch of different prescriptions that have to be given and a number of different changes that have to be made to the nature of the power training program. But nonetheless, I think it's a very, very all-encompassing variable as far as maintaining independence in older populations.
Yeah, and you brought up a really interesting point there that I think sometimes isn't always recognized. We typically associate aging with loss of muscle tissue and loss of strength, and we assume that those are kind of the predominant leading edge of the physiology of aging. But from what you just said, it sounds like power is almost the leading edge of that deterioration to a certain extent.
Yeah, absolutely. I can show you, I could show you graphs that indicate the declines in power and the declines in strength, and certainly you'll see the declines in power are greater. And by the way, if you just think of it from a functional point of view, and think about your everyday activities, you can actually picture how important power is. For example, if I ask you to get up out of a chair, you don't get out of a chair as slowly as you can. That's painful. What
Yeah.
you do is you accelerate yourself up out of the chair. In other words, you add velocity to the strength component in order to get up out of a chair. And it's the same thing when you're climbing stairs. All of these activities that we think of strength-based activities are really power-based activities.
Yeah, such a great point. And I often do that activity with my students when I'm trying to explain the difference between strength and power. I say, get up out of the chair slowly. And if you try to take 5 seconds to get up out of a chair, it's a painful experience.
It really is. Yeah. And I do that all the time at my lectures. I'll
Yeah.
find someone and just put a chair there. And you'll notice the only way people can really get out of a chair, if we ask them to go very slowly, is by changing the position of their feet and practically rolling out of the chair.
Yeah,
so it just indicates how important velocity is to it.
Yeah. So let's get into a practical conversation here. I think we've established the clinical and the theoretical basis for this, but our listeners are frontline fitness professionals that are working with clients every day. So how should they think about integrating this into a training program for the aging adult? Because I feel like this is as important of an area as this is. I think there's a little bit of hesitancy to do this type of training with the aging adult, because I think the paradigm is, we use this for athletes and it's going to be explosive. Right. And so how should fitness professionals think about integrating this?
Well, first, let me get rid of the fear. We've been doing this now for 30 years at the University of Miami, and I have not had any injuries in any of my training programs. So I think you don't have to be afraid of power training. And if you think about power training and the way it's typically done, what we're trying to do is increase the speed of movement. And so we're talking about that load velocity relationship. So if we're going to increase the speed of movement, the best way that I know of to do that is just to drop the load. Mm-hmm. So if regular training is sub-maximal, right? We know that. It's, normally if we're looking for strength, we're somewhere between the 70 and 85% range when we're trying to use it in a general population at any rate. So what we'll do is drop down even lower than that. And depending on the joint that's involved, we may be somewhere between 50 and actually 40 and about 60 to 70%. Mm-hmm. To maximize power, which means the load is going way down. Then when you actually perform the activity, we do a high-speed concentric, mm-hmm. and we do a low-speed eccentric. Mm-hmm. So what we're trying to do is protect the joints and the muscle tissue during the eccentric component, because, these high-speed eccentrics are typically what we think of in plyometric-based training. And certainly, I don't want to start someone or even train someone on a regular basis using a high-speed plyometric unless they're really ready for it. So I would say if you use the high-speed concentric and then the controlled eccentric, you can feel safe about providing power training. And then it's just a matter of determining the optimal loads, and you can find those. I have some papers already. If I've linked my Vita to your site, so people can look up the papers on optimal loading and be able to determine what loads would be best in order to do the training.
Yeah, and we'll link up to that in the show notes page so people have an opportunity to take a look at that. I think the one thing that comes to my mind as we talk about, power training is how the modalities that we use to actually, implement this, because, there's certain things that might work with an athlete that will not work with an aging adult. So what have you found from a modality perspective? I know that you've done a lot of research on, pneumatic resistance, but talk to us a little bit about modality, because I think that's an important part of the discussion.
Yeah, I think there are a number of modalities that will work we've already compared pneumatics to plate loaded machines, mm-hmm. and we had the same results on both. Also, some people have used rubber tubing, which mm-hmm. is an interesting way to approach it, because certainly rubber tubing applies increased resistance as you go through the range of motion. So I think these are two modalities that can be used. We prefer the pneumatic machines for a number of reasons. The pneumatic machines, as you know, pneumatic simply means that what we have is air pressure within cylinders. And so what we're really trying to do is compress that air within that cylinder, and that's creating our resistance. So the first thing we like about that is that it gives us a real nice, smooth length tension curve. So through the range of motion, we get a very, very nice, consistent load. If you do high-speed training with a plate-loaded machine, or even with free weights, now what happens is, as you start that lift, you have to break inertia, right? And as you break inertia, now the plates develop a certain momentum. And we've shown this, and other people have over and over again. Once you go ahead and you try that at maximal speed, now what's going to happen is the plates are going to separate from each other, or the bar is going to come away from your hand. And what you're going to have is you're going to have these loading, unloading phenomenons throughout the range of motion. So we don't consider that optimal, because obviously what I'm trying to do is get loading through the entire range of motion. And when I lose that within the range of motion, I'm losing part of the exercise in effect. The other thing that we don't like is, as you're going through and performing high-speed movements, and that bar does pick up momentum, or the handle, or whatever you're using on a machine, now what happens is you have to decelerate that plate or bar at the end of the range of motion. With a pneumatic machine, the pressure is continuing to stay on it, and so that deceleration is almost automated. All right, I'm not saying you don't have to decelerate to some extent, but it's not the same as that unloading that typically takes place. And we know that the greatest potentials for injury are happening at that end range of motion as we're trying to decelerate that bar. And that means that what happens usually as we're doing these high-speed movements on machines other than the pneumatic machines, or maybe even electromagnetic braking type machines, what happens there is you have to begin to end your movement. Some people have argued 50% through the movement itself, you're already beginning deceleration. So that means that really the optimal velocity of movement for performance is only taking place through the first half of the movement, and from there on in, you're slowing the movement down. So we really like the pneumatics from that point of view. And then the other thing that we like is the displays. A lot of times when a personal trainer is working with an individual, they're constantly giving them feedback and trying to encourage them. And we do the same thing in our laboratory. The nice thing about having a display is we can show the people what their power output is on that display and ask them to match the power output, and then show them what a decline in power output looks like and how they can try to maintain it through a set. And this has been tremendous for us as far as trying to get people to understand what it means to move at high velocities. Because when you first tell someone to move at high velocity, that's the same thing as trying to tell them to move the greatest weight they can. They have no idea how fast they can move, nor do they have any idea of what the greatest weight they can move is. And so having some type of feedback is very helpful.
Yeah, that's great. And I thought what you said is really interesting with regard to, particularly a free weight based movement of having to decelerate your motion. I think everyone who's lifted weights that's listening to this understands that if you don't start slowing down as you near the end of the range of motion, I mean, you're going to, destroy a joint in the process. So, but 50%, that's a very interesting figure to know that, you basically are doing half the movement slowing down.
Right.
So give us an idea, because pneumatic machines aren't exactly common, kind of fitness industry wide. What are some of the pneumatic machines that are on the market that you've used that you've found helpful?
Well, the two that we use in our laboratory are the Her machines and the Kaiser machines. We love both. The Kaiser machines right now for us are major machines that we've been using for years and years and years. We just got our Herm machines, and actually both are being used right now in studies. And both of them are supplying for us all of those variables that I told you about. In other words, we know that we don't have to be afraid about bar acceleration. We know that we can get constant feedback. We know that our individuals can move at high speeds during their concentric portion, and still we don't have to worry about potential for injury. Yeah, so those for us are the two major machines that we use.
I'd like to take a quick break from today's episode to tell you a little something about one of our sponsors. As all of you are well aware, addressing the wellness paradox is a lifelong passion project for me. And when you're going to go on a long journey, it's difficult to go it alone. You need to find like-minded individuals that are willing to go on that crusade with you. And that's exactly what I found at the MRF Institute. The team over at the MRF Institute creates educational content for fitness and wellness professionals who are serious about becoming a part of our healthcare continuum. Getting on the healthcare continuum is all about leveling up our skills to be looked at as that valued resource provider. The wellness paradox is certainly an avenue for you to do that, but we need many different levers to pull if we're going to get there. And the MRF Institute is definitely one of those levers. You can go to their website, mrfinstitute.org, to find all kinds of great, informative, free informational content. And if you choose to engage with any of their paid content, they've created a coupon code specifically for Wellness Paradox listeners. You can enter in WP 2022, that's WP, and then the number 2022 to the website at checkout to receive a 15% discount on your purchase. I highly recommend you go check out mrfinstitute.org. Now back to today's episode. Great. And we'll link up to those in the show notes page, just so people have an opportunity to actually check out what these machines do. And, the feedback component, I think you mentioned is so important, and I would think that that's even a little bit more important for maybe an older adult population that hasn't engaged with strength training. Like I at least have some idea as someone who's been lifting for 30 some odd years, what high velocity and high load looks like. But I would think for people who have less experience, that visual feedback even becomes more important.
Yeah, it really is. I mean, when we can show someone's either the power number, the wattage during a lift, or in the case of I believe the new displays for Kaiser, and certainly the displays for her, now there are actually bar graphs that show the amount of power for each one of the repetitions. And so when these visuals come out, as well as I do, when you can see that, now you can really explain it. I just had the opportunity day before yesterday. We have a study going on right now with our Herm machines with Parkinson's patients. And one of the patients did not understand what we meant as far as moving at high velocities. And the undergraduate student who was working with him had not seen the power screen that was available on the Herm machine. So I showed that and explained it and let them watch the bars as they climbed. And it was amazing to watch the difference in the lift, because that feedback is so meaningful.
Yeah, exactly. Yeah, that's the benefit of technology that I'm sure you've seen evolve so much over your time doing the research, is that real-time feedback.
Yeah, I mean, there's no doubt about it. That to us has been, I think, a big game changer. We have, when we initially started, our machines did not give all of this feedback. And, I admit that we tried to do high-speed training, but I honestly believe exactly what you said, and that is people do not understand what you're talking about when you tell them move those weights as quickly as possible.
Yeah.
And the interesting thing for us now is we're using some velocity-based training, and looking at velocity deficits to target different areas along that load velocity curve, because we believe that they're going to be related to different activities of daily living. We can't prove that yet, there were some initial studies by Kuko and his group that said if I want to increase gait speed, I'll go to the velocity end of the curve. In other words, lower loads at higher velocities. If I want to improve standing from a chair or climbing stairs where we move more against gravity, I might move more to the load end of the curve. He was very successful on the velocity end. Toward the load end, there was some question. But still, I believe that we have to have that flexibility to move from that concept of optimal load. You have to train right in the middle where the optimal load is to understand that we have the ability to give a prescription where we can move from one end to the other, depending on what we feel the needs of our clients are. So, for example, for our Parkinson's patients, we like to move toward the velocity end of the curve because we know that is a dictate of the disease, that they're going to have bradykinesia, they're going to move more slowly. And so our initial training is toward that velocity end of the curve.
Yeah, that's really interesting. I think, I mean, I just think of the sport performance world as an analogy, and that makes a lot of sense. The power profile of an offensive lineman versus a running back, is going to be very different, where the offensive lineman is going to be on the strength end of the curve, and the running back is going to be on the velocity end of the curve. So that's very interesting that you are starting to examine that in the aging adult population.
And we use that same thing. When I teach, I use exactly the same thing. I go a little more extreme to you than you do. I compare a Olympic lifter to a tennis player.
Yeah.
But the concept is exactly the same. And so what we try to do, and what I suggest should be done, is to analyze that older individual, find out where their strengths and weaknesses are, and adapt your power training to that, because we can change the area at which power is increased. We always think of this peak in the middle as where we always want to target, but it really shouldn't be that way. The target of where we want to maximize power should be dictated by the need of the individual.
Yeah, absolutely. So you've mentioned your research, several times during this conversation, and you said something earlier which was interesting. I'd like to dive into all the exciting areas that you're really interested in your research, but you talked about the role of power training and cognitive decline, and that really piqued my interest because that's not an area that I've seen a lot of work done in as of yet. So just touch on that for our audience, because I think that's a really interesting area.
Yeah, there's been some interesting research that has shown a correlation between power output and cognitive decline. And certainly there's some research, a good body of research that's shown a relationship between aerobic capacity and cognitive decline. I don't consider either of these an absolute, but I do consider both of these contributors. And so what we have been trying to do in our laboratory now for the last 3 or 4 years, and we're working in collaboration with our ophthalmology department, who is checking changes in the vasculature in the retina as indicators of changes in vasculature in the brain. In other words, to improve blood flow to areas of the brain in order to improve cognition. So what we have been doing is using high speed circuit training. So what we'll do is, rather than doing, let's say, 3 sets of power training and then move to another machine and another machine, we do optimal load for power on a machine, move to the next machine, to the next machine, to the next machine, very, very short recoveries in between. So what we're trying to do with the power training itself is increase the power output, dealing with that side of the coin for cognition, because we know that anaerobic training can cause increases in the vasculature within the brain, improvements in increasing the number of dendritic connections, the connections that improve cognition. We know all of that can happen with anaerobic, and we also know it can happen with aerobic. So if we do a high-speed circuit, the power that we get from each one of the machines gives us that anaerobic power component of it. By taking short recoveries, of course, now what we do as we move around, we move more and more aerobically, because obviously the shorter the recovery, the more we push you toward a more aerobic component of exercise. And so we've been doing this now and having very, very good success. We've been showing positive impacts on cognition, and the changes that we're seeing in the retinal vasculature are just great.
Fascinating. Yeah, I think this is just an important conversation to introduce because, certainly, physical function is critically important, and that's traditionally what exercise professionals focus on. But there's such an interplay between, the cognitive function and mental health and movement and exercise that it's really encouraging to hear that, research is being done to actually look at this directly.
Yeah, and it's nice to be able to know that with this type of training, we're always talking about getting the biggest bang for our buck. Yeah. If we can go ahead and increase power outputs while we're also increasing cognition, now I can say, not only can I improve your capacity to be able to work functionally, I can also improve your capacity for executive function, the ability to be able to do an activity as dictated by the environment around you. So things that we have to do in our everyday life, like crossing the street, I need the speed of movement to make sure I can get across the street, but I need the executive function, especially here in Miami, to know when I should step off that curb. And all of these things work together, I think, in order to really give us maximal independence.
Yeah, and you said it. It's bang for your buck. It's efficiency. We're coming to the end of our discussion here. I feel like I could just keep asking question after question, but I think one of the last good questions to end with is a little bit of how the fitness professionals that are listening to this should consider incorporating this into a routine for possibly a newer exerciser. You wrote a great book, Bending the Aging Curve. It's actually one of my favorite books talking about training the aging adult population. We'll link up to that in the show notes page, but just as briefly as you can, how should fitness professionals be thinking about progressing somebody to power training? Because I don't think we're suggesting anyone to get into the gym on day one and start going at maximum velocity.
No, in fact, we're advising against it.
Yes.
Right. Now, what we normally do is we will give what most people will call a hypertrophy period. I like to think of it more of a tissue adaptation period. In other words, if I'm going to, I don't care whether I'm looking for increasing strength or increasing power. If I'm going to give those types of overloads to muscle and connective tissue, what I need is a period of time for adaptation. And I'd say the worse the condition of the individual, the longer it's been since they've exercised. And be careful, because people will tell you what great condition they're in by telling you what they did when they were in high school, when they're 65 years of age. And those two things, as you know, have nothing to do with each other. So bring people along slowly. So, one way that we like to do things here at the laboratory that have been very successful is just simple periodization. So use a hypertrophy period. Don't be afraid to give a month, 2 months of slow, gradual improvements. People say, oh, 2 months, it seems too long. But my argument is, I'd rather wait 2 months than hurt someone and tell them they have to wait 6 months before they can come back and get trained. So bring them up slowly. Then the next thing we normally work on is a strength component. And the strength component, we've seen it maximize anywhere from, I'd say 8 to 12 weeks, we see a peak in the strength component. The power component normally is next for us, but it's much shorter. Our power cycles normally are peaking somewhere between 4 and 6 weeks. And then that's where normally I would picture a competition period. But our competition period is life. So now competition now is reflective of what you're trying to do in your training. So in other words, if competition is cognitive, now what we'll do is we'll do dual tasking. ask them to do a physical task along with a mental task. We also have some active executive function things that we do. So that might be the active portion that we'd have in our recovery period there. If, on the other hand, it would be everyday activities, we do movements that simulate that. And then obviously, if it's for balance, it's going to be balance training, proprioception. And this, we've shown that that's really not necessary. We can go right back into our training. What we like about it, though, is it gives variation.
Yeah.
When I go and I give a lot of my lectures, I do a portion of the lecture called The Best Meal in Town, where I pick someone out and ask them would they go to dinner with me, and ask them what their favorite meal is. And let's say they say lobster. I say, okay, we'll go for lobster today. Say, great. All right, good. You want to go out again tomorrow for lobster? I haven't got any farther than 5 days before someone said, can we have something else to eat? And that's the way I look at training. Now some people love to do the same thing over and over again, but most of us like that variation. And we find that a lot of our subjects here get very, very excited when we start to take them off the machines and show them how to translate that improvement that they made in the machines to their everyday activities. So I think that's a nice pattern to use. And that's a pattern then that can evolve over multiple years.
Yeah, I like how you frame that up, but it is the traditional linear periodization structure. You tissue adaptation phase, hypertrophy, strength, power, competition period, recover, rinse, lather, repeat. It's kind of the process.
Now, I will say that we have compared the linear periodization. I never believed in linear periods. I always call it nonlinear, the arguments that are made that no periodization could ever be linear. But at any rate, we do that common periodization. We've compared that to daily undulating periodization. And the cool thing is we got the same results both times. Yeah. So if some of your clients would prefer to vary across the days, this is after, of course, the tissues have been prepared. Right. There is no problem with doing a strength day, a power day, a hypertrophy day. If you want to mix a movement day within that where they do everyday activities, balance activities, whatever, that works just as well as the typical traditional periodization.
Yeah, and I'm glad you brought that up. And I do think particularly for the exerciser that likes variety, sometimes that could even be a little bit more engaging.
Yes, our people really liked it. They honestly did. And it was interesting to us to see, even in our older population. It had already been shown in a younger population, but in our older population, the same thing was true, that we got very, very similar results between the two.
Yeah, and we're going to link up to all of the information that you sent to me with all your publications. But where's the best place? If somebody wanted to go one place to learn about what Joe Signorile is doing, where's the best place to go?
I don't know. I really don't. No,
You've done so much.
The reason I'm laughing about this is I remember that we had talked about this previously, and so I started to do a search for myself. And there are certainly videos of my lectures in various places, but I couldn't find a gold mine anywhere where I'd say go here or go there and find it. My suggestion is, take a look at my curriculum vitae. If people are interested in any of the papers, you have my information. I'm happy to send out PDFs of papers, or go ahead and search on the web and find, I have a lecture just recently done with the International Conference of Active Aging. I don't know where that's available or if it's available, since I wasn't able to find it. But my suggestion is that I'm sure that there are a lot of videos out there, because people keep telling me, I saw your video on power. And maybe I'm not that great at my age at surfing the web, but I wasn't able to find it. But I know they're out there.
Yeah. Well, we will link up. You sent me a lot of great information. We'll link up to that. We'll certainly link up to the Bending the Aging Curve book, which I think is a a must read for, fitness professionals that are working with the aging adult. So yeah, I guess it's good that you're at the point in your career where there's so much information that you've put out as a researcher that it's hard to say where to find it. So we'll link up to as many of those things as we can in the show notes, and you're, a very accessible person. So, emailing, seems like you'd be willing to send out a PDF if needed. So that's great.
Absolutely. Yeah.
Well, before we end, I want to ask you the question that I always end the podcast on, which is the thesis behind the wellness paradox, which is that the wellness paradox is this trust, interaction, and communication gap that exists between fitness professionals and the medical community. If you could give fitness professionals one piece of advice to close off that gap, what would it be?
I think it's exactly what we're doing now. I think that that we always think that this is going as a one-way street. For example, me speaking to the fitness professional. But a lot of what I say, a lot of what I do, a lot of the research that I've done, and a lot of the ways I present is really coming from the other direction. Mm-hmm. For years, I traveled around and lectured on the fitness stage. And I learned how to present the information. And I also learned what was of interest to the individual who's working with an older population. Mm-hmm. And I think that this is a very, very important two-way street for us, that you should not consider us people who work in isolation in a laboratory somewhere and don't consider what you're doing. And we should not consider you someone who's working in a gym that has no idea what we're talking about. Mm-hmm. I remember when I first went to teach, someone said to me, I told someone I was going to teach force velocity curve and what it had to do with modifications in training. And I was going to relate that to bioenergetics. And the person told me, you can't teach that because no one will be able to pick it up. And I think that is a tremendous insult to the fitness population, because not only could they pick it up, they could teach me things that I didn't know. So my recommendation is attend things like this. Invite us to come and talk to you so that we can exchange ideas, because I need to know what the problems are out there mm-hmm. in the fitness community so that I can design my training in order to do that. We do all clinical studies. Mm-hmm. And so I need to know what the best clinical question is. And so we're more than happy to have that interaction. And I think that that's an important thing.
Well said. Dr. Joe Signorile, thank you so much for joining us on the Wellness Paradox.
My pleasure. Thank you for inviting me.
Well, I hope you enjoyed that conversation with Dr. Signorile as much as I did. If you found it insightful or informative, please share with your friends and colleagues. Those shares make a real difference for us. Any information we'd like to share with you from today's episode can be found on the show notes page. That's wellnessparadoxpod.com/episode 91. And I really encourage you to check out that show notes page. There's a lot of great information up there. Please be on the lookout for our episode 2 weeks from now when it drops. And do not forget to subscribe on your favorite podcast platform. Until we chat again next, please be well.